Welcome to Wednesday's edition of COVID-19. A fresh high for Korea today as the daily tally has jumped past the 1,000 mark. Healthcare workers at the front lines of the pandemic are working around the clock to tend to the surging numbers of patients, while authorities for their part are looking into the possibility of raising social distancing and ensuring some form of economic stability at the same time. I have our Kwon So standing by with more on the pandemic numbers. So let's begin here on the local front.
All right, Sunny. Well, after we saw over 1,000 cases for the first time on Sunday, it happened for the second time this Wednesday, only with an even higher number. 1,078 cases were confirmed this Wednesday. That raises the total to above 45,000 here in the nation. And we also have a similar number of deaths reported in the past day, just like the day before. And with almost 12,000 people currently in quarantine, we also have 21 more people which are currently in serious or critical condition. That number is standing at 226 now. And 1,054 infections today were domestic transmissions, again a record high. And that's also partly due to more tests conducted since the beginning of this week, and that to detect the virus as fast as possible. Some 3,300 more screenings were conducted on Tuesday than on Monday, breaking another record when it comes to daily test numbers. And new infections have been traced to numerous locations across the country, as well as during day-to-day activities. But recently, we are seeing resurgences, especially at medical facilities such as nursing homes and nursing hospitals, as well as places of worship. By region, we have around 770 infections counted in just the metropolitan region, far over 300 in Seoul and Gyeonggi-do province, 67 in Incheon. And just to take a quick look at some of the most serious spots, 75 in Jeollabuk-do province, and also 41 cases down in Busan.
I see. And despite those numbers, Soa, there has been no word on a further rise in social distancing from authorities as of yet.
Well, Sunny, if we take a look at the developments of the past week, we have cases in the high 600s to above 1,000. And as of this Wednesday, a daily average of 833 domestic infections over the past week were reported, which means the main criteria of level 3, a daily average of between 800 and 1,000 domestic infections has been met. But that's not the only factor that has to be taken into account.
We
will consider many factors in our evaluation, including our disease control and medical capacity, the forecast of the outbreak based on the virus reproduction rate, the proportion of elderly patients and those in serious or critical condition, as well as the level of public consensus regarding social distancing measures.
We will have more details on that issue with our Kim Han-ul in a bit, but let's take a look at the situation abroad now. There will also be countries in Europe facing changes in social distancing, including the UK. In London, they have raised social distancing to a very high level. Also, Germany implemented more restrictions beginning this Wednesday, while in Indonesia, there will be a ban of crowds getting together at Christmas and New Year. And let's take a look at the daily surges, which are really serious in the U.S., still over 200,000 infections, followed by some 44,000 in Brazil, and also over 32,000 new cases in just a day in Turkey. With that, the global figure in total stands at 73.8 million. And those are the updates I have for now. I'll be back with more tomorrow. Back to you, Sunny.
All right, Soa, thank you. Right, as mentioned earlier, authorities here are looking into the possibility of raising social distancing in the country with minimal impact on the economy, if possible. For more on these intentions, I have our Kim Han-ul here in the studio. Welcome, Han-ul.
Good afternoon.
So let's begin with the latest from the government with regard to social distancing guidelines, Han-ul.
Right, so the government has been taking a very cautious approach, and they've been finding it more difficult to stand their ground in recent days. Take a listen to what Prime Minister Chung Se-kyun had to say.
The government is doing its best to properly enforce the current social distancing guidelines. However, we cannot rule out the possibility of raising the measures to level 3 as a last resort.
The Prime Minister added that considering the wide-ranging impact of level 3 social distancing, the government should not make a hasty decision. Prime Minister Jung called for stricter enforcement of penalties for violating social distancing guidelines and ordered 1/3 of all government employees to work from home until the end of this year and prohibit any type of social gatherings at the workplace.
I believe officials are also urging for greater public support in the distancing campaign.
Right, so a top public health official said yesterday that level 3 social distancing requires cohesive effort from the public in order to be successful. Yoon Tae-ho, a senior official at the Central Disaster Management Headquarters, said that during a media briefing yesterday that the toughest level of social distancing can only be effective when everyone works together. Since level 3 cannot be implemented over a long period of time due to its heavy economic impact, it requires a broad social consensus before it can begin. Another senior health official, Son Young-rae at the Central Disaster Management Headquarters, also said yesterday that he is not sure if level 2.5 social distancing is working as it should. He added that public fatigue has grown over the months, and despite raising the scheme to level 2.5, confirmed cases in the capital area had continued to spike. So he thinks we should at least wait until the end of this week to make an accurate assessment of whether level 3 social distancing will truly be effective.
So what changes are in store under a level 3 alert then?
Well, under the current under level 3, the highest level, more restrictions will be implemented with any gatherings of more than 10 people banned. Currently, level 2.5 distancing is in effect for the Greater Seoul area. Level 2.5 social distancing allows gatherings of less than 50 people and sporting events without spectators. Restaurants are allowed to offer takeouts after 9 p.m., while cafes cannot have customers sitting in at any time. However, once level 3 is implemented, people will be asked to stay at home at all times, and companies are required to adopt teleworking for non-essential personnel. All schools will switch to remote learning, and small retail stores will be closed after 9 p.m. And larger stores with a floor space of more than 300 square meters, such as department stores, outlet malls, and supermarkets, will be shut down. However, this has caused some confusion since the guideline says groceries, convenience stores, and bakeries will be allowed to operate, and some supermarket chains are in a gray area.
Right, Hannah, one final question before you go. How are authorities here seeking to address the shortages in hospital beds?
Well, senior health officials say that improving the turnover rate for critically ill patients may help secure more space for severe COVID-19 patients. Yoon Tae-ho, a senior official at the Central Disaster Management Headquarters, said that if patients in relatively less severe condition among the critically ill can be moved to a non-ICU unit equipped with oxygen ventilators, it could improve the turnover rate for ICU beds and leave more room for COVID-19 patients in serious conditions. Seoul government officials said it will designate 2 hospitals in the city to house recovering COVID-19 patients to free up more space for the critically ill. However, some medical experts point out that the government needs to make more efficient use of its existing healthcare infrastructure. Kim Yoon, a professor at Seoul National University Medical School, says that there are more than 10,000 available ICU units in the country, but only 2% are being used to treat COVID-19 patients, as many of these beds are in for-profit hospitals that have been reluctant to allocate beds for COVID-19 cases. He says incentivizing private medical institutions to open up might help alleviate the shortage in hospital beds.
All right, Hannah, thank you for that coverage. I'll see you again next week.
Thanks for having me.
Also on the local front, private firms are seeking to do their part to address the shortages at medical centres by using their technology to create negative pressure isolation tents. We have details in this following report.
밝혔듯이 정부는 향후 20일간 최악의 상황을 가정해 충분한 병상과 생활치료센터를 확보하고 특히 확진자가 하루 이상 대기하시지 않도록 한 분 한 분을 빈틈없이 지원해 드리겠습니다.
On December 14th, Korean health authorities said they were working to secure some 10,000 additional beds at hospitals and care facilities nationwide to handle the surging number of COVID-19 cases. Modular isolation wards built inside shipping containers were also hastily set up in the Seoul area as hospital beds began running out. They've been critical in filling the immediate gap, given that it usually takes many months to build a negative pressure hospital ward.
음압격리병상은 그냥 방에다가 음압기만 설치하면 되는 것이 아니고요. 그 병동을 전체적으로 코로나19 환자분들만을 위해서 전용을 시켜줘야 되고 안에 구조를 바꿔줘야 돼요. 전실이나 또 그곳으로 이동하기 위한 동선 이런 것도 따로 분리해서 마련을 해야 되기 때문에 필요한 만큼 바로바로 만들어내기가 어렵다는 제한점이 있습니다.
The Seoul city government has a policy of classifying patients according to the severity of their illness. The government is doing all it can to ensure that COVID-19 patients are not forced to receive treatment at home over the lack of hospital beds, especially in light of concerns over possible aerosol transmission.
우리나라는 공동주택의 형태로 되게 많이 되어 있는데 그러면 그 과정 중에 전파시킬 우려 이런 부분들이 남아있는 거죠. 그래서 감염의 통제나 또는 환자분들의 안전을 위해서는 의료기관 내에서 치료를 받는 게 가장 안전한데요. 문제는 발생하는 환자의 숫자가 그만큼을 따라가지 못할 때에는 불가피하게 이제 자가 치료와 같은 형태를 선택하게 될 수밖에 없을 것 같습니다.
Amid these concerns, negative pressure tents that serve as makeshift hospital wards have emerged as a viable solution.
저희 음압 텐트 같은 경우는 그냥 에어만 공급하면 바로 구조물이 완성이 되기 때문에 필요할 때는 아주 신속하게 설치가 가능하고요. 음압 시설을 유지한다는 거는 실제로 이제 기밀도 굉장히 중요하거든요. 그래서 저희는 이제 이중막 구조에 여러 가지 내부적인 어떤 구성들을 좀 다채롭게 개발을 해서 실제로 사용하는데 이제 불편함이 없도록 저희가 개선을 했습니다.
The negative pressure tents also come equipped with changing rooms, where medical workers can safely take off their protective gear and undergo decontamination. The contaminated air inside the patient rooms are sterilized through UV lights and HEPA filters. Negative pressure tents have also been set up in this walk-in screening center at Samsung Medical Center in southern Seoul. The designers of the negative pressure tents are working to address any shortcomings and develop new improvements.
저희가 초기에는 이동형 선별진료소 같은 간단한 시스템에서 시작을 했지만 현재는 이제 경증 환자나 중증 환자도 입원해서 치료할 수 있는 이동형 음압 병실까지도 현재 유수의 기관들과 공동으로 개발 중에 있습니다.
These negative pressure wards could be the solution that we need amid the dangerous shortage of hospital beds triggered by the latest resurgence of COVID-19.
It's time now for part 7 of our special coverage on Korea's free economic zones. I have Peter Bint here in the studio with me, as always. Welcome back, Peter.
Good afternoon.
So I believe we're poised to talk about the Gyeonggi Free Economic Zone today.
Yeah, that's right. Also known as GG Fairs, it straddles the cities of Pyeongtaek and Siheung, and it's a free economic zone that is pursuing investment inflows. Gyeonggi Province is an administrative district close to Seoul and Incheon, which are large metropolitan cities. When including the 31 cities and counties of Gyeonggi Province, along with Pyeongtaek and Siheung, it has the largest population area in Korea.
I see. I hear there is a reason for its current expansive name, though.
Yeah, at the time of its designation in 2008, it also housed and included Chungnam Province. But the new region has been renamed the Gyeonggi Free Economic Zone in October 2020. And as the sole free economic zone in Gyeonggi Province, it is pursuing strong growth by strengthening its identity and brand value.
So what has the zone achieved thus far?
Well, the Siheung-Pegot district is the first zone to be designated in 2020 and will undergo further expansion as a result of this. The Future Mobility Technical Center and Daewoo Shipbuilding and Marine Engineering's Wavepool Research Center have already been completed in Siheung-Pegot district, and these developments gave it the justification to be selected as a free economic zone. Not one to rest on its laurels, though. GG Fez plans to further expand the free economic zone in the Gyeonggi Province region. Also, the authority is moving forward to attract investments to Siheung-Pegot district, existing Pyeongtaek Poseung district, and the Hyundok district. Then let's take a closer look at a report about the advantages of investing in the GG Fez. Gyeonggi Free Economic Zone, which is the sole special economic zone in Gyeonggi Province, is close to a semiconductor cluster centered around Samsung Electronics and an auto industry cluster comprised of automakers like Hyundai Motor Company. As a result, it is a good investment area with potential for strong growth with a solid research infrastructure.
경기 경제자유구역청의 가장 큰 장점은 개발 지역의 인근 산업단지보다 저렴한 분양가가 가장 큰 장점이라고 말씀드릴 수 있습니다. 또한 K6, 캠프 험프리 등 미국 생활권, 영어 생활권이 가능한 평택시의 국제도시로서 만들어지기 때문에 이러한 외국 기업에게 중요한 정주 환경을 제공하는 것이 가장 큰 장점이라고 말씀드릴 수 있습니다.
Gyeonggi Free Economic Zone is near Incheon International Airport and also other major ports in the region, allowing one to fly to Northeast Asian destinations such as China and Japan in just 2 hours or less. Connected to the Seoul metropolitan area by highways and railway and within an hour from the city limits, the Free Economic Zone is reachable from major provinces and cities within 2 hours. Pyeongtaek Port, one of Korea's 3 largest trading ports, is growing into a global logistics hub.
평택항은 대중국 수출입 전진기지로서의 허브 역할을 담당할 수 있고 특히나 13개의 컨테이너 그리고 5개 라인의 카페리를 운영하고 있고 우리나라 자동차 수출입 처리량 국내 1위, 세계에서 3위를 담당하고 있는 무역항으로서 발전하고 있습니다.
So Peter, Pyeongtaek Port is the largest port in the country with regard to the volume of car trade, and I suppose this is an asset that related firms are betting on.
Yeah, absolutely. Korea's leading automakers all have factories in Gyeonggi Province and have subsequently created an auto factory cluster. Pyeongtaek Port is the main port where cars are imported and exported. As such, Kia Motors has its own pier for doing such things, cars and parts alike, allowing it to directly export to 170 countries, which gives it a competitive advantage. Factoring in these investment advantages, Hyundai Mobis, the largest auto parts firm in South Korea, decided to locate its electric vehicle parts factory in Poseung District, Pyeongtaek, in August of this year. The size of the investment is about $32.5 million, and it is expected to create 300 jobs directly and indirectly.
Peter, what other factors prompted this investment?
Well, this year an additional plan was drafted for the Poseung district as a future centre of an eco-friendly automobile industry. The plan garnered much attention for its growth potential in auto-related industries. In addition, land acquisition costs that were 35% lower than that of the surrounding area and fast administrative approval for permits were also important factors.
I see. Meanwhile, what other achievements have been secured thus far?
Well, in November of this year, 5 foreign logistic companies in Poseung District, Pyeongtaek, attracted a combined total of $676 million in investments. The fact that Poseung District is situated near a port was one of the decisive factors in winning the investments, and also because of its prime logistics location and proximity to the Seoul metropolitan area. In the future, these companies will build and operate large distribution centres and also have manufacturing and wholesale operations under the same roof. To achieve this, they plan to hire 730 people, and this will create an additional 6,691 jobs in the surrounding area.
So what industries look to rule the zone, so to speak, in the future?
Well, after experiencing some stagnant growth recently, GG Fairs plans to create an innovation cluster that will take a lead in the fourth industrial revolution. Let's take a look at the following report to see the new strategy of GG Fairs. The Gyeonggi Free Economic Zone will be comprised of the Pyeongtaek Poseung District, Hyundok District and Siheung-Baegot District once they are completed. They will be developed and interconnected to each other to become innovation clusters that can lead the fourth industrial revolution.
우리 청은 서해안 시대의 글로벌 거점 조성을 목표로 포승지구는 친환경 클러스터 조성, 현덕지구는 서비스 산업의 클러스터, 올해 6월에 확정된 시흥 105지구는 육해공 무인 이동체 및 의료 바이오 복합단지로 조성될 것입니다.
The Poseung district will be revamped into an eco-friendly future automobile cluster with strong ties to the battery, electronics and auto parts industries. Hyundok district in Pyeongtaek has commercial facilities like the Pyeongtaek International Ferry Terminal and Pyeongtaek Lake Tourist Complex that relies on tourism. It also has residential areas with future tenants that include international schools. The business outlook is good with optimism in the tourism and the logistics sector. There are plans to build an unmanned ground, sea and air vehicle demonstration research centre under private-public partnerships in Siheung-Baegot district.
Peter, do tell us a bit more about unmanned vehicles.
Well, unmanned vehicles, they don't just cover cars, it's all modes of transportation on ground, sea and air, and it recognises its surrounding environment and plans a route. Self-driving cars and drones are unmanned vehicles that we are most familiar with, but there are also unmanned farm equipment vehicles and unmanned ships in development.
Good to know. What are the prospects for this new market?
Well, the US consulting firm McKinsey predicts that 80% of the world's top automakers will complete commercialization of advanced autonomous self-driving technology by 2025. In addition, the Ministry of Science and ICT forecasts that the unmanned vehicle market will grow by 20% annually by the same year.
Now, Peter, I understand this market depends on a joint venture, so to speak. Please do elaborate.
Yeah, public-private partnerships are really crucial here, especially in the unmanned vehicle business. There are 7 universities, including Seoul National University, located in the Siheung-Baegot district, while manufacturing companies in the parts and material business can be found in the Siheung Smart Hub. The Sihwa Multi-Techno Valley, known as MTV, which is the first smart industrial complex in Korea, and other state industrial complexes are within a 5-kilometer radius. In addition, there are 55 companies, including Hyundai Motor Company, in the area, making it an ideal place for private-public partnerships. The whole product development process, from developing unmanned vehicle prototypes, new unmanned vehicle technologies to testing prototypes, will be able to take place in the Siheung-Baegot district under its overall plan. Key research facilities such as the Future Mobility Technical Center and Daewoo Shipbuilding and Marine Engineering's Wave Pool Research Center have already been completed, and an Intelligent Unmanned Vehicle Research Center is currently under construction.
I see. What else is in the plan for this region then?
Well, the district will also create a residential area as well as a medical and biotech industry cluster by 2027. The building of a general hospital with a capacity of 800 beds in cooperation with Seoul National University Hospital has already been confirmed, and this will meet the demand for healthcare services in the region and further strengthen the healthcare infrastructure. In the future, when the land, air and sea unmanned vehicle industry and the medical and biotech industry begin to grow robustly, the total number of new jobs is predicted to be about 16,000 with an economic ripple effect of $6.4 billion.
Quite an achievement. And now here is the grand question, Peter, I keep asking towards the end of our session. What benefits do investment firms look to secure?
Yeah, well, they get an 85% reduction in local taxes, including acquisition tax and property tax for 15 years, while foreign invested companies will receive a reduction in land acquisition costs in the metropolitan area, allowing them to acquire inexpensive sites in the metropolitan area when signing private contracts. In addition, when an investment is made, a professional project manager will be assigned and give consulting advice on all the investment details.
I see. All right, Peter, as always, thank you very much for that. I'll see you again on Friday.
See you then.
Right, it's been said quite frequently that kindness is one of the most difficult things to give away because it's usually returned. Well, up next, to tell you a tale about a kindness that was returned, I have Jared Kurzik, a former Peace Corps volunteer who served in Korea, live on the line. Welcome to the program, Mr. Kurzik.
Nice to be here. Thank you very much.
Now, before we delve into your story of service and friendship, Mr. Kurzik, could you please start by telling us a bit about the COVID-19 situation over in the US?
Yeah, after watching your report, it's very severe here, as your viewers can see. We're at 17 million cases, total cases in the U.S. since March, and I live in the state of Ohio, and we're over 500,000 here. And according to the news today, they talked about we're in our third spike from spring, summer, and early winter. So this is something that's a disease of a magnitude I've never seen, and I hope I never see it again. And in my small town of Athens, with population 25,000, we've had 2,600 cases since March. Only 6 deaths, so luckily, but that's still 6 too many.
Right. Mr. Kurzik, now your first visit to Korea was about 4 decades ago as a young man volunteering for the U.S. Peace Corps. Please tell us a bit about that.
Sure. Well, I served in the Peace Corps, and the Peace Corps is just like Korea's KOICA. And Peace Corps was in Korea from 1966 to 1981. And during that 15-year period, about 2,068 volunteers served. It was usually a 2-year period. I served for 3 years. I was teaching in Yecheon in Gyeongsang-bukdo, close to Andong, and I was teaching at Daechang Middle School. And during the vacation periods, we did teacher training. And during that time, we'd wash up outside, crack the ice. You had curfew at midnight. You'd have to make sure you were home. You had big country breakfast in the morning, which took getting used to. And we were in the period of the Semaul Undong, where you'd be woken up every morning at 6 a.m. with the Semaul song, and everybody get out there and start cleaning the streets of our neighborhood. So it was a great time. Wouldn't trade it for anything.
Right. And Mr. Kurzik, in a humble gesture of gratitude for your kindness back then, I understand the State-run Korea Foundation sent you and other volunteers who served in Korea back then a COVID-19 survival box. Could you tell us what was in it?
Sure. I think everything was in it, including a big dose of Korean jung, Korean affection, Korean love. But what we also saw in it, too, was KF94 masks. We had microbial gloves. We had cultural items that reminded us of our days in Korea, like our Maxim Mocha Gold Mild coffee, which we would always eat or drink rather in the tabangs. We have some hongsam candy, so red ginseng candy, and where I was from in Yecheon, it's very close to Pungi up there, famous for its insam. We also had cultural, a folding fan, a silk fan, and another item, couple items were these facial masks, beauty masks. I'm saving this for the day that we get rid of COVID, and then I'm going to have a nice facial. when that all happens.
Right, Mr. Kurzik. Now, I'm assuming you were quite touched by this gesture. What were your thoughts upon receiving that gift box?
Oh, sure. It was overwhelming. And just thanks and just wondering how fortunate I was to have served in Korea as a Peace Corps volunteer. And Korea continues to amaze me. And again, the COVID survival kit, it wasn't just a box. It was a gift in more ways than one. I arrived in Korea on January 10th, 1977. That was on my birthday. And what a fortuitous day, because it's been the gift that keeps giving. And so the items in the box brought back a lot of fond memories. And one of the very nice items was a USB stick they put in there, and the Korea Foundation, which we thank very much, they had a lot of memories and thanks for there. And anybody that watches it, even if you were not a Peace Corps volunteer, it brought tears to your eyes. So all the volunteers have said that. I showed it to my family, and they were crying more than I was.
Right. Meanwhile, Mr. Kurzik, public vaccination against COVID-19 began in the U.S. this past Monday. What is the public response to the public vaccination? And may I ask if you plan on getting inoculated?
Sure. For my answer for myself, I'm sure I'll get vaccinated. Right now in the state of Ohio, because it's being done on a state level, and our population is almost 12 million in Ohio, they're phasing it in. We have a phase 1 for high-risk workers and first responders, a phase 2, which is older adults and people living in overcrowded conditions. Interestingly, too, these include prisons in the state as well. And then there's the next phase, and that's critical risk workers essential to society, and I'm probably in that category with teachers.
Right. All right, Mr. Kurzik, it's been a pleasure talking to you, and thank you for your service back then, and thank you today for making the time to talk to us.
Okay. Sure, and I wonder if I could just, on behalf of all the Peace Corps volunteers and members of Friends of Korea, just to the Korea Foundation and just President Gun Lee and his staff and all the Koreans, just 진심으로 감사드립니다. 항상 건강하시고 새해 복 많이 받으십시오.
Thank you very much, Mr. Kurzik.
Bye-bye.
We are definitely not in the game of comparing regulators across countries, nor on commenting on claims as to who is better. This is not a football competition.
백신 선구매를 위한 국가 간 경쟁도 치열한 상황입니다.
News of inoculation over in the UK and US appear to be fueling some optimism on the economic front, but pundits remain cautious over global market prospects as inoculation efforts appear to look concentrated in certain countries only. For more on this, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
I also have Professor Song Soo-young from Chungang University. Good to have you back, Professor.
Thank you for inviting me again.
Dr. Kim, according to the People's Vaccine Alliance, rich countries have laid a claim to more than half of the doses that can hit the market next year. In fact, some of these nations have enough vaccines to inoculate their populations multiple times over. What are your thoughts on this trend?
Well, unfortunately, we are actually witnessing just recurring the vaccine nationalism, and despite some international cooperation for including the vaccine development and distribution, but those collaboration actually is not quite enough just to cover all the some vulnerable population at the moment. And then this is the reality, and then we are actually just there are some issues of some political issues and cost issues, so we have to somehow just deal with it. Yeah.
I see. Professor, so what impact, if any, has news of vaccinations had on the global market?
Currently, the vaccination has clearly delivers a very good prospect, and for the economy to coming back, to grow back again. But however, still, even though we have witnessed the divergence of the asset market and the real economy, but however, In some countries have recorded a very positive economic growth rate, GDP growth rate, that is a far remote country and easily contain the spread of the coronavirus. Those economic countries are not at all affected. But however, most advanced countries have suffered so much from the spread of the coronavirus. But still, the prospect is positive, I believe.
Right. Dr. Kim, amid the so-called vaccine hoarding by wealthy countries, it's also been said that 18%, just 18% of the global population at most will be inoculated by next year. Now, surely this figure will fail to end the pandemic for the world.
Yeah, that's true. I mean, for the herd immunity, we are actually talking about just herd immunity. And then according to the current sort of just R0 or reproductive numbers, we are actually expecting like a 60 or 70% of immunity is required for herd immunity. For one single country, I think maybe just, their vaccination may be enough just achieving the herd immunity. But if they just continue to just close their border. But the current situation, all the global economy and things like that, we need some kind of some communication and the international travels, so that the herd immunity, this has to be achieved for the globally, not for any just certain countries. So yeah, that's what I can say now. And then the one herd immunity for one country is not just enough for just stopping the current pandemic.
Dr. Kim, just out of curiosity, what would serve to ensure an effective end to the pandemic, a cure or a vaccine?
I think we need both of them, because I would like just compare the cure. I mean, in this case, as a drug is like some spear or sword, and then the vaccine is like the shield. We need both of them. And then for the, obviously some vaccine was very just effective to, for example, like eliminate certain infectious disease, such as like a smallpox. That was actually eliminated on the globe, on the earth, except for some few specimens on some few laboratories in the US and Russia. So I think the vaccine would be very just effective way to just eliminate such kind of infectious disease. But we need both, and then somehow just the drugs and then the vaccines are some actually complementing each other.
Right.
The country has invested in some Oxford AstraZeneca, and so that is a public investment and public finance and a private investment case. So India and South Korea would receive the vaccines as planned. But the Pfizer and the Moderna, which was developed privately, that issue is still it is very expensive, and the issue has been brought in the WTO case. So this issue becomes like intellectual property issues, and combined with some transfer of technology and those values to some undeveloped and less developed countries. So this is the issue of the intellectual property and whether it should be treated as a public good or not. So it's a little bit complex.
Right, but the WHO has been saying it should be treated as a public good, though.
That's right.
Dr. Kim, I understand there's been some progress on the treatment front here in Korea. Could you elaborate?
Well, as far as I know, the front runner in Korea is the therapeutic antibody, and then many people know just the Celltrion is one of the front runners to develop the therapeutic antibody. And then for that, the 300 people were already recruited for the phase 2 clinical trials. And I think I'm expecting some the data analysis by probably this month, or at least the next month. But I think that this month, probably even just before Christmas, we will see some results. And for some two of the results are coming, and one is for just Camostat, and then the other is Nafamostat. For the Camostat, this is the both drugs are acting very the similar way. The both drugs actually just somehow prevent the infection of the virus into the cells. So then the Camostat, 900 patients were enrolled, and then treatment I think was already finished. And then for the Camostat is also, I think we are expecting some data analysis before the Christmas Day. And therefore, the Nafamostat, those clinical trials, phase 2 clinical trials were conducted in Russia, and for a total of 100 patients. And then those enrollment of the patients and the treatment is over. So we are expecting also some final data analysis this month or next month. So I think in the near future, at least we are expecting the 3 completed phase 2 clinical trials for three different drug candidates.
Dr. Kim, the development of a vaccine or cure requires astronomical expenses that only rich countries can afford. What are your thoughts on this reality?
Well, obviously, the development needs some R&D just capability in addition to just funding. So those capacity can, at the moment, they can be provided only for the certain countries like some U.S. and Europe, and then some other just selected country. So I think that's kind of a reality. But the securing such a kind of drugs or vaccines might be affected by just the wealth of the certain countries. And then we are actually not just ignoring just such kind of a reality at the moment.
Right. Professor Song, speaking as a scholar of economics, what can you tell us about the economic value of developing a cure vaccine against a pandemic?
Clearly, development of the vaccine and the cure medicines are very essential and for the advanced country and the population concentrated countries. However, when you look around the world, for example, Egypt and Guyana, who is a neighbor of the Venezuela, their economic growth rate has recorded more than 20% or positive percentage of growth rate, very amazing. The reason is because despite the lack of the vaccines, but those countries are very sparsely populated and separate and remote. That is automatically achieved, so that is the containment of the disease also plays a very important role, as well as development of vaccine. So, but anyway, our country is very populated, and so we have no choice but to rely on the vaccine and the cure, and then very short temporary lockdown would be effective. In terms of the policy choice, I recommend very short temporary and period very strong lockdown would be necessary. Then we can disperse the vaccines and other cure medicines to the people.
I see. So, Professor, you do support the idea then of raising social distancing to level 3?
Maybe, but it should be very short time.
I see. So the timing is very important. Yeah. What economic impact, Professor Song, does Korea's vaccine procurement effort look to have on the economy when compared to other countries that have already started their vaccination campaigns, like the UK and the US?
Yeah, recently I see this in the CNN interview to Michael Keane, who is a 91-year-old British person in London. He has mentioned that it's silly, the herd immunization or anti-vaccineers are actually silly, and he argued that it's no time to die right now. Even though he is 91 years old, he would like to hug his grandsons and daughters, but those are most dangerous to the old people because they are become a very easy, very big source to deliver the disease. So I believe our country's current plan has already invested in Oxford AstraZeneca, and then we have to wait, and then also we must bring those issues WTO, and then if people or countries need those vaccines, those should be distributed. But still the EU has opposed implacably. So that is a really issue, but our country has survived very good, and only we have 1,000 patients. But some people in Frankfurt has told me that, oh, Korea is very dangerous. Okay, 10,000 people die per day. So their concern is more than 1,000 people has died just one day, but still, we are in very good situation. So,
right. Dr. Kim, what are your thoughts on the amount and timing of Korea's vaccination campaign?
Amount and time. Well, I think for those kind of the older vaccination plans, the Korean government is still just considering with or just talking with some professional, even just earlier of the pandemic, the current pandemic. And I think they are considering the many just aspects of such things, including the vaccine safety and some new platform technology, for example, like mRNA-based vaccine for the Moderna and then the Pfizer, and also some herd immunity issues. And then although the the current the situation in terms of a number of just confirmed cases these days is pretty just concerning issues. But I think government will just take all the issues into consideration, and I think they will take some necessary measures for that. Yeah.
Right. And talking about measures, Professor Song, the government has taken a very cautious approach to raising our social distancing levels, claiming that the economy will suffer tremendously. Could you give us a better picture, perhaps, of the economic repercussions in the case of raising social distancing to level 3?
Yeah. Even without increase of the social distancing in November in 2020, the United States economy has increased, productivity has increased. That is the report available. So actually, from when we look just a very big picture about the country, the effect or impact of the coronavirus is very strong against some self-employed restaurant, cafe, not agriculture, no fishery, no manufacturing, which was automated very much. So therefore, we need some very different approach then, because this becomes readily transferred to the political issues. Even though the landscape of the economic growth looks very good, but that is the divergence still is very present. Therefore, we need to take care of the people who suffered so much. But economically, that does not impact, or that is not a burden to the economy. So, but despite that, still we need to take care of them. So that is the issue.
Right, Professor Song, as always, thank you very much for your insights. And Dr. Kim, thank you for being with us today. Right, well, it's time to say goodbye now. We'll be back tomorrow with more coverage on the pandemic, so do join us then. In the meantime, do take care, and thank you for watching.